everyone and welcome back to my channel, and in today's video we're going to be talking about autism. And the reason we're going to be talking about autism is because I recently received my diagnosis of being autistic, and I wanted to talk about it. I wanted to give my experience. I'm going to try and leave this whole series, so there's going to be about 8 videos in the series, and I'm going to try and leave this series as unedited as possible. Obviously, if I do trip over my words like loads, then I will cut that little tiny bit out, but I'm going to try and leave the likes, the ums, the try and leave all that in, because that is just me, and I want to be unauthentically apologetic. I don't even know if that's the right way to say that, but I don't want to be apologising for who I am. And I get that in some of my other videos where I'm not talking about autism, and because previous to this video I've never announced the fact that I'm autistic online. I may have mentioned it occasionally, but I've never really made it a big topic. So I edit a lot of my videos. I edit them quite badly. I edit all of the ums, the out, because that's just what social media is like. But I want to start trying to be better on social media, and all you can do is try and improve. So from this video forward, I'm going to try and edit my videos less and make them a little bit more me, which I hope will make you resonate with me. So if you're liking what you see so far, then please don't forget to hit that subscribe button and leave a like and a comment on this video. I am an autistic creator. I have been my whole time on this channel, and if you're new here and you're wondering, who am I? My name is Deanna and I live within the UK, and I am 29. I've just turned 29, literally this month, well, last month when you're watching this video. And I wanted to kind of become a little bit more myself on this channel, because I feel that I've been struggling to do so. So without further ado, let's go ahead and get started. And trying to remain so strong, I know it's good if I'm alone. I got it, So at the beginning of this video, because I'm not a health professional, I am going to be giving a little bit of a disclaimer, because the information I have got for this video I have pulled off the internet, and it is going to be a bit wordy, but then this is the only video in this particular series that is pulled from the internet, from actual words. I'm going to try and give my own experiences where possible, but I am not a health professional. I cannot diagnose people. I am just giving the information that I found on the internet and making it a bit easy to digest for someone who may not want to read all of the information and may want to listen to a video. With all that being said, I'm going to start off and talk about what is autism. Autism is a communication disorder. It is defined as one of the conditions under the neurodivergent category. So if you're neurodivergent, you may be autistic. If you are sitting there thinking, I think I'm autistic, there's no harm in going for an assessment. There is no harm in looking into it, and there's no harm in doing some of the free online quizzes, which I will try and leave some of the free online quizzes in the description box down below. But I'm going to be talking about the signs today, because there is quite a few, and also if some of these don't apply to you, then don't start getting worried that you don't have autism if you meet, say, 5 out of the 6, but don't meet the 6th one. There are different ways to look at it, and if you ever had an assessment, when I had my assessment, they asked me loads of different questions to try and get me to meet criteria, and in my assessment report, which is going to be one of the videos that I'll be talking about, it kind of gives sort of mild, moderate, severe, kind of how strong they were able to get the evidence to support my diagnosis. So I will be going through that as well. So as I said, autism is a communication disorder, and it is also part of the brain and the way the brain works. You are born with this condition. You don't catch it. It's not like COVID. You can't catch this disease. It's not like a common cold. It's not like COVID. You can't catch it. It is something you're born with, and it's just the way that you are made. Almost similar to how people are born with Down syndrome, or they are born with other chromosomal, whatever that word is, chromosomal conditions. Kind of similar to that, but it's in a different category. So autism is different to Down syndrome, but in the same way, you'd be born with both of them. The only biggest difference, that if we were to compare autism to Down syndrome, is that Down syndrome can be tested for. There is a blood test. You can see that someone has got a missing chromosome. Whereas for autism, not all the symptoms for everybody are present straight away, or they might not be present as severely to kind of make your caregivers think that it might be autism. So for me, in my childhood, I was seen as a normal child. Yes, I had social difficulties, and yes, I didn't really have many friends. Yes, I was bullied throughout the whole of my primary, middle, and senior schools, but that was, children will be children sort of thing. Also, everyone thought. Obviously, a certain amount of the bullying can be chalked up and contributed to just that school life. That's how it is. But I struggled a heck of a lot in schooling, and it wasn't just down to the social element, it was a lot more down to like the way I was perceived by others, what I would say, and that goes down to the communication thing. And in next week's video, so I'm going to work more generalized things today, and then in next week's video, so these videos we posted every week on a Monday for 8 weeks. And in next week's video, I'll be talking more about me in specific, whereas this video, oh my god, I feel like I'm repeating myself, and I'm so sorry. And I said I was going to leave this unedited, so I'm probably going to have a slightly longer video, but I'm going to try and move this on quicker. So another part of autism is finding sensory quite overwhelming. So this can be different from autistic to autistic, but some people find noises, some people find like lights, some people find like pitches of certain noises like more difficult, some people find the temperature more difficult, some people find touch really difficult. For me, I find the pitch of a noise, like if it's really like high pitched, like a child squealing or the screeching on the tubes in London, I find that really difficult. And also the volume of a noise. If the volume is really, really loud, it's quite difficult for me to focus or concentrate. Also, if there is a lot of noise going on, if there's like a lot of talking in the background and then I'm trying to focus on one conversation, which is actually part of a disorder called auditory processing disorder, which is one of the things that can come along with being autistic. And auditory processing disorders, really briefly, is a condition in which somebody can struggle to focus on a conversation if there's too much going on in the background. So for me, I serve the food for the kids sometimes, and this is the best example I can give you. I'm behind the counter trying to listen to this one child and what this one child wants, but all the other children are talking to one another, and because it's a collective and there's loads of children talking, this noise becomes overwhelming, and this becomes louder than the child in front of me, and that is the best way to describe it. Another behavior that is related to autism is that somebody may take longer to understand like the actual task or the thing they've got to do. So this can manifest at work by people asking, the people that are autistic, asking a lot of questions and stuff like that. And in my experience, I found that some neurotypicals or other colleagues I work with can see that as undermining, or they can see that as I don't want to do the task. That is never the case. It is a case of I just don't understand what I've got to do. And this is heightened when I'm in an environment that I feel out of my depth, or I feel like I don't know what I'm doing. And I ask all these questions to try and do the task to the best of my ability and to do the task up to the standard that they want it done. And when I feel like I can't ask these questions, that's when like it becomes difficult for me, because I so want to do this task as well as I can do it and as good as I can do it, but when somebody dismisses me or makes me feel like I can't ask these questions and makes me feel stupid, then it also then kind of impacts emotionally, and I'll be getting into all of that next week. But yeah, that's kind of just an example to help you understand that bit. Another trait of autism is struggling to figure out how other people think and feel, and this is often described as trying to like read between the lines, and how autistic people can struggle to read between the lines. I struggle to read facial expressions, I struggle to read body language, and a lot of the time I may think that somebody is upset with me or someone's angry with me when actually they're not. They're just busy, or they're just like upset in their own personal life, and sometimes I will take this on as I think they're upset with me, when in actual fact they're not upset with me, they're upset with something completely different, or they're angry at a task that they couldn't complete, or it's something that's not even related to me. But if I'm in the environment, I will constantly have to say to somebody like, are you upset with me? Like, are you like angry at me? And I constantly think that maybe it's something I said, and I fear the issue that may arise if it is something that I've done. And the final thing that I want to discuss in terms of the traits of autistic people is that they all do or say the same things over and over. So this may manifest as stimming, which, if people don't know what stimming is like the same repetitive movement. So me doing that would be classed as a stim, like, or tapping my feet, or rocking back and forth, or like doing the same action, like swinging in a chair, but like doing it as a self-soothing technique, which is the definition, kind of like a definition of a stim. I will see if I can get like a definition and put it down here of an actual definition of what stimming is. But it's a repetitive movement to help self-soothe, is my understanding of it, and I'm pretty sure that's what the definition is going to say. It's important to remember that being autistic doesn't mean that you can't live a full life. Actually, you can. You can live a life that is as full as anyone without autism. It may just need to have some adaptations or some ways to help support you emotionally, physically, however you struggle the most or struggle at all. And to also remember that low support needs does not mean no support needs. So I am considered a low support needs autistic, but that does not mean I don't have any support needs. Like, I do. I have quite a few, to be fair, for someone who is low support needs, but it, in comparison to somebody who has higher support needs, would be a lot less, if that makes any sort of sense. So now I want to get a little bit more specific in terms of actions or behaviours that somebody with autism might display. And the key word here is might, because not all autistics display these particular symptoms. They need to meet the criteria, obviously, to get the diagnosis of being autistic, but some of these symptoms you might not have, so please don't worry if you don't meet all of these symptoms. So some people with autism may avoid eye contact. That is probably the biggest one that everyone thinks when they think of autism, is somebody like staring off into space, or rolling their eyes, or like not rolling their eyes, but like kind of like looking up and then looking down and trying to avoid eye contact. And that is a common misconception when so they do that, but what I mean is like the rolling of the eyes thing. Neurotypicals think that like doing that is rolling your eyes, whereas autistics tend to take it very literally and think that rolling your eyes is rolling your eyes, like proper, like from one side right across the top and to the other. They think that is rolling your eyes, whereas neurotypicals seem to think that looking up and down again, that's rolling your eyes. And so there has been numerous occasions where I have tried to avoid eye contact because I find it like uncomfortable, and I've kind of looked up and then I've looked back at the person and they've said, "Why are you rolling your eyes at me?" And I'm like, I'm not. Like, I'm avoiding eye contact. I don't like eye contact. And they're like, "But you just rolled your eyes." And I'm like, I didn't roll my eyes at you. Rolling my eyes is looking and going right over. And they're like, "No, you just rolled your eyes." And it comes into a big argument. And I've lost friends over it. I've lost relationships with colleagues over it. Like, it is difficult to like explain, but I'm not rolling my eyes. Like, I'm avoiding the eye contact. That's completely different. Another sign of autism is somebody not able to understand the social rules or the perceived social rules. So this may be finding it hard to like insert themselves in a conversation when like everyone else seems to be able to like jump in when the conversation is at the appropriate time, whereas the autistic person has got this like idea in their head as to what they want to say, but they're going, "Can I say it now? Oh wait, can I say it now?" And they're constantly trying to like guess. And this is why having autism can be so tiring, and it's why autistic people are more prone to burnout and things like that, because even just going to work and having the social element of work is tiring, because that person is having to constantly not just know what to say in a conversation, but know when to say it, know how to say it, know like how long of a pause is enough of a pause to be able to then insert themselves in a conversation, to be able to pay attention to the other person's body language. Like, am I saying what I've said, is that okay for the other person? Like, we are constantly working in overdrive. And so socializing is tiring. It's exhausting sometimes. Some autistic people don't like it when other people are too close to them. So, for example, a busy tube train would be really upsetting for someone with autism, potentially. For me, it's upsetting, but it's something that I've learned to cope with, / maybe mask. I'm trying to slowly unmask some of my behaviours, and like tubes are something I don't always do, but I always play headphones and music and stuff. So maybe that's my coping mechanism for it. But yeah, they're not the most comfortable of things, but then I would get someone go, "Well, no one thinks they're comfortable." or something like that. And I'm like, yeah, but it's actually kind of painful for me to be on a tube. But you know. A lot of autistic people will also notice small changes in fine details. So whether that be the behaviour of a person, or whether that be just literally looking at two different colours of orange and being like, well, that's a burnt orange, and that's a medium orange, and that's a pale orange, and that's a pastel orange, and being able to notice the very small differences in colours, like, that is more of a women's thing, because we do know from science that women and men's eyes are different. But I'm talking about even just behaviours, even just like, oh, you've cut your hair, or oh, you've tied up in here really well, like it's looking really good, even if somebody else might come into the environment and go, it still looks a mess. The neurodivergent person is going to say, yeah, but they've tied up their sofa, or they've tied it up and they've hoovered, and they notice the small details in a room or in a person's behaviour. Another sign of autism is having a very keen or special interest in a select few activities, and these are known as special interests. They're known as like topics that you absolutely are just enthusiastic about, and you know every single detail about, or you spend hours researching all these different types of animals. For example, for me, I used to love cross stitch, and now it's diamond arts. That's one of my things. I love the singer-songwriter Demi Lovato. She is like, I don't know, like, just, I don't know. I don't know how to describe it. It's more than a fan, but it's like, I can remain cool and calm and collected, but internally I'm screaming and being like, it's Demi, you know? And I suppose you could see that as fangirling, but it's like, when I was younger, I would spend hours researching where she was born, like, you know, her life growing up. Like, I even had a college project where I had to write about the life of a celebrity, and I got like a proper like high mark in that, because I literally went into like her social, her like financial, all these different things. I went into like her mum's history, like her history. Like, I literally wrote a whole college project on Demi Lovato, and it literally was like, when they said, oh, you could write about any celebrity, I was like, Demi Lovato. Like, who else am I going to pick, you know? And another one for me is, I love the colour purple. I love wearing the colour purple. It's an obsession to the point where, like, I'll choose purple towels, purple cushions, purple curtains. Like, even behind me, there's purple curtains, purple bed sheets, purple blinds, purple, like, decor pieces. Like, anything purple makes me happy. Like, if I had to choose a background for something, it'd be purple. And another thing that can manifest within autism is, like, the like to plan things very, very thoroughly and very, very methodically. So this may be when the person has to go to a new place, or has to try something different, or has to go to a new job. They will plan like down to, I get this bus, and then I get off this bus and I go on this bus, and I have to walk this will take me 5 minutes, and they will plan it step by step. Whereas like another person may say, okay, I need to be there by this time, what sort of time do I need to leave? And they won't necessarily maybe plan it down to the fine-tooth comb. Like, an autistic may go, okay, I need to get on this number bus, I need to get on at this particular time of this number bus, and then that will get me into the station at this time, and then I plan to go and get a meal deal or something for lunch, so that will take me 5 minutes to pick out a meal deal and to pay for this meal deal, and then that gives me 5 to 10 minutes before my train arrives, something like that. And they will look at it that far, and then they'll go on the other side of the journey, like, okay, I'll get off that train at this time, and then I will plan to walk to the next station, and that gets me there at this time. And they will plan it so methodically, and it can take them hours to find the best route, or the route that they feel is the best for them, because obviously we also have to take into consideration our sensory needs, our like fears, our anxieties over different modes of transport. Like, for ages I hated fast trains, and then I overcame that by going to my best friend. And then it took years for me to overcome that, by the way. And then I had a fear of taxis, and that took me ages to be able to overcome that. And there were so many fears, and a lot of the fears were based on what someone might describe as an irrational fear. But for me, it was very rational. For me, it was something that I could not do a task because of a fear, or because of an anxiety over something. So now I'm going to move into more kind of signs of autistic in females, because autism does manifest itself very differently in a female, because a female is more likely to mask their symptoms, or hide their symptoms, or have a different way of like expressing their symptoms. They're more likely to do their symptoms in a private setting versus a more public setting, and this is just more likely. This isn't necessarily like they are going to definitely not do it in public. It is a more or less type thing. So a lot of females who are autistic, myself included, have learned or taught themselves to fit in. They have taught themselves the social cues, and a lot of this is socially. Women are taught to be proper, and women are taught to behave, and women are taught to listen to men, for example, and like all these things. A lot of this is taught as proper etiquette or proper like way to sit at a dining table, or like a lot of things are taught like that in an upbringing. At least it was for my upbringing. And like, I went to a private school when I was younger, and we were taught to only hold our fork in one hand and our knife in another hand, and I couldn't do it. I'm right-handed, right, but I eat left-handed, and I'd always get told off for eating left-handed because I was right-handed. A woman who is autistic is also more likely to hide their feelings, or if they feel upset, go somewhere more quiet to go and calm down. Whereas someone who is maybe male with autism might be very vocal about it and be less socially quiet. I'm trying to put this in a way that is acceptable to say, but the behaviours of females are generally more introverted versus a more extroverted type of behaviour in males. And I'm not saying this as this male must be an extrovert and this female must be an introvert. No, I'm talking about the type of behaviour. I'm talking about an introverted sense of behaviour. So whereas trying to hold back the tears, not screaming in public when they feel like they need to and things like that, is more of an introverted form of behaviour. Whereas boys, a lot of the time, are seen more doing more like bigger, like gross motor stims. Get your words out, Deanna. But they might stand there and do hand flapping and go like and make noises with it and stuff like that, and they are more seen to have like more public outbursts and things like that. And that is not all the case, obviously, not always the case. Some men with autism do present more like a feminine like version of autism, but it isn't true that autism is like the same in both males and females. The symptoms are still there, and the DSM-5 criteria, or DSM whatever it is, criteria is still the same for both males and females, but the behaviours and the way they're presented is different. Autistic women also appear to cope better in social situations. It doesn't mean they actually do cope better in social situations. So a female might be able to cope in a social situation, but may then feel exhausted when they get home, or have an outburst and have a panic attack when they get home, or they might feel very like burnt out really quickly. That is a few examples of how an autistic female may present. Also, going back to the repetitive behaviours and the stimming between the differences between males and females, females are also less likely to show repetitive behaviours, or if they do, they are more covert stims. So when I say about a covert stim, I mean like something that is not as noticeable, whether it's scrunching and like sort of rolling your toes in like your shoes, or whether it's bouncing your leg up and down, or whether it's like twitching your fingers and doing it like down by your side, or like inside of a coat pocket or something. An autistic female is more likely to do that in comparison to a male who is more likely to be very vocal or very like outwardly displaying of their symptoms and their stims. So it is also important to remember that autistic people can be just as intelligent as someone without autism. Autistic people can be as intelligent as the next person, the someone who is not autistic. And I do find that a big misconception is that people think that autistic people are dumb, but actually there is someone that I heard about recently, and I'm not entirely sure what it's, I think it's like wordsicantSay.com or something like that. It was an autistic person. I think he might be based in the US, maybe, and he is a person who is non-verbal, who is considered to have a level 3 autism, which is one of the higher levels of autism, and would be classed as more of a higher support needs. But he can type, and I think he can type. He basically writes a blog, and however he managed to write the blog, but his words, it shows he has a high level of intelligence. He just can't communicate that in the typical sense. And so someone with autism can be just as bright as someone without autism. It just means that they have a different processing system in their head, pretty much. So it is not clear as to what causes autism, but it is important to remember that autism is not caused by vaccines, it's not caused by bad parenting, it's not linked to diet, there's lots of things on here where it says not linked to all these different things. It is not an infection that you can spread to other people, things that I've already mentioned in this video. And it is important to remember that, because when you have autism, you're born with it. It's not something you can give to anyone else. It's not something that you can like spread or be contagious, as I said at the beginning of this video. So if you hear anyone saying anything about that, then please try and stop that stigma, because it is not true. So I know we're getting towards the end of this video, but I wanted to just clarify a couple of other things. So there are 2 different names for autism. However, in my area, we do not use the Asperger's label anymore. I know that that was something that has been used and may still be used in other countries, but currently here in England, and I'm in the southeast of England, they do not currently use Asperger's, they just use autism. They also don't diagnose in levels here anymore. I don't know whether that's a widespread England thing, whether it's an international thing, but currently in my area, they do not diagnose with levels or with anything apart from high support needs, low support needs. And that is I asked the person who diagnosed me, and she said it's to stop people from thinking that low support needs means no support needs, because you still need support. And also it's important to remember that autism is a spectrum, which means that somebody can struggle in one area of autism more than another area. Someone may have really, really high and bad sensory needs, whereas another person may find that they can't talk. You know, it is such a spectrum, and there's quite a few different criteria, and each criteria can be more or less higher or lower support needs. And the high support needs, low support needs is an overall picture of all the symptoms, whereas someone might have a high support needs in terms of communication, but lower in terms of like intelligence, like support needs, like they don't need any support in terms of like their actual academics. Whereas you can get people with autism that need a high level of support with their academics and with communication. And so there is so many different types of autism, but types of struggles within autism. And just as we are getting ready to close out this video, I wanted to just end with a few conditions that can and may present at the same time or alongside autism. So one of the most popular / most talked about, I think, is ADHD and autism, or a lot of people refer to it as ADHD. I think I have ADHD, my best friend thinks I have ADHD, and therefore I'd have ADHD, but I definitely think I'm more autistic than I am ADHD. My best friend might disagree with that one, but yeah, I think I'm definitely more autistic. So I, at this current point in time, don't feel the need to seek out a ADHD assessment. Later in life I may change my view on it, but currently I don't feel the need to seek out a ADHD assessment. Another one is dyslexia and anxiety, and it also says here depression and epilepsy, which I had most of those, to be fair. I had anxiety and depression growing up. I had epilepsy also when I was growing up. I have dyslexia, and I'm not sure about the ADHD, but I will get on to talking about that in my next video, which will be next week. So I'm going to end today's video here, but next week will be all about my personal autism diagnosis story. So it'll be less about reading off of like a piece of paper, because I currently have a piece of paper which has got information on it about autism. Obviously I know a lot of it, but I wanted to make sure that I got the facts more correct. But next week's video is going to be more about my personal autism diagnosis story, and then the week after that is going to be me talking about the actual criteria that I met, how I met them, all that sort of stuff. So yeah, don't forget to hit that subscribe button, leave a like and leave a comment if you've liked this video. Also, if you've got any video suggestions you'd like me to make, maybe to tag on the end of this series or something, then let me know, leave me a comment, and I shall always try to heart and get back to everyone who comments. But thank you so much for watching, and as I say at the end of every one of my videos, please don't forget that I believe in you even if nobody else does. And I shall see you in my next one. Bye!
Just like you're young again, no don't you cry, just get back up again.